Assalamu alaikum, my lovely nurses. I hope you are all fine. So today our topic is diabetes mellitus. Diabetes mellitus have two types, type 1 and type 2. Diabetic mellitus type 1, diabetes mellitus type 2. So today we will talk on the type 1 diabetes. So in the type 1 diabetes, there is a deficiency of insulin. Insulin deficiency. What is insulin deficiency? So which part of our body is making insulin is pancreas. So if there is a insulin deficiency, the pancreas have deficient insulin. So what will happen if the DM type 1, the pancreatic beta cells, the pancreas have beta cells. So if there is type 1 diabetes, what will happen? The beta cells destruction of the pancreatic beta cells which produce insulin. So pancreatic beta cells are responsible to produce insulin. If the destruction of pancreatic beta cells is there, type 1 diabetes will be the cause. This will cause the type 1 diabetes mellitus, and this result in absolute insulin deficiency. Absolute insulin deficiency. So type 1 diabetes mellitus, insulin deficiency. Pancreas is responsible to make insulin. Which part of the pancreas? The beta cells. The beta cells are responsible to making insulin. If there is a destruction of the pancreatic beta cells, what will happen? Absolute insulin deficiency. Now, as I told you, in the DM type 1, insulin deficiency. So if there is an insulin deficiency, what will happen? The impaired metabolism of fat protein plus carbohydrates. If there is insulin deficiency, impaired metabolism of fat, protein and carbohydrates, the fat and protein and carbohydrates will not metabolize properly, impaired metabolization. And if there is a impaired metabolization of the fat and protein, what will happen? Hyperglycemia. If hyperglycemia is there, what will happen? The fatigue, hunger and weight loss. If there is a hyperglycemia. And now if there is a fatigue, hunger and weight loss due to hyperglycemia, what will happen? It will cause polyuria. Polyuria means the increased urine. Cellular starvation. Cellular starvation. What is the cellular starvation? Mean they cannot nourish cells. The cells will not take proper nutrition. That is cellular starvation due to hyperglycemia, fatigue, hunger, weight loss, already impaired the pancreatic beta cells. So polyuria will happen, and the cellular starvation mean the cells is not properly nourished. And after, if there is a polyuria, cellular starvation, what will happen? So if there is cellular starvation, what will happen? Ketones the produce in response to cellular starvation. Cellular starvation is the cause of ketones, and the cells cannot nourished due to the absence of insulin, because they are not receiving, there is no insulin deficiency. So what will happen? Ketones. Why? Due to the absence of insulin. And if this all problems are there, what will happen? Ketoacidosis. The ketoacidosis is the other topic, the DKA, diabetic ketoacidosis. We will discuss about this topic inshallah after the two types. So ketoacidosis will be happen. So now we will talk about The insulin deficiency, what insulin deficiency require? Insulin deficiency require, what require? Exogenous insulin. Exogenous insulin. What is exogenous insulin? That is originating from outside the organisms. So insulin deficiency required the use of exogenous insulin to promote appropriate glucose use and blood glucose level. So insulin deficiency require exogenous insulin. What exogenous insulin will do? Exogenous insulin will elevate the blood glucose levels such as hyperglycemia. So exogenous insulin, what will happen if the patient have high blood glucose level, ketoacidosis? So that will prevent the complications related to elevate blood glucose levels such as hyperglycemia, diabetic ketoacidosis and the death. The decay is a danger side of the diabetes mellitus. So the exogenous insulin is very important for the diabetics type 1 patients because they are only using the insulin. So it will help the patients to prevent from the complications of the DM type 1 complications. And the second, diagnosis is based on presence of classic symptoms. The diagnosis of type 1 diabetes is based on the symptoms and an elevated blood glucose level. For example, patient came to the emergency, patient will give you the symptoms according to the DM type 1, and when you will check the blood sugar level, that will be the high. What is the normal blood glucose level? 70 to 99 milligram per DL or 4 to 6 millimole per liter. So this is the normal blood sugar level. So diagnosis depend on the symptoms and the patient blood sugar level. For the children may need to be admitted directly to the pediatric intensive care unit because of the manifestation of diabetic ketoacidosis, which may be the initial occurrence leading to diagnosis of diabetes mellitus. So for the children, we have to more careful, should be admission and the blood glucose monitoring, because maybe child have DKA, the diabetic ketoacidosis. So it's depend on the symptoms and depend on the blood glucose level of the patient. So how we will assess the DM patients? The assessment. In the assessment, we will talk about the hyperglycemia and hypoglycemia symptoms together. But I will inshallah give you the different lecture on the hypoglycemia and the hyperglycemia, because that is very important this topic, because mostly in the exams questions are coming related to hypoglycemia and hyperglycemia sign and symptoms and the management. So that we will do the different lecture inshallah. So we will talk about the assessments, we will talk together all the sign symptoms. So what sign symptoms, what assessment we have to do? Keep in your mind 3 P's. 3 P's mean polyuria, excessive urine, polydipsia. Polydipsia is excessive thirst, and polyphagia, excessive hunger. So these 3 P's keep in your mind. Then number 2, hyperglycemia. As I told you, the diagnosis, we will do diagnose according to the blood sugar level. So when you will check the blood sugar level, it will be high, more than 70 to 99 milligram per deciliter or 4 to 6 millimole per liter. And the patient weight loss, and explain fatigue and lethargy. Fatigue and lethargy, Headache, patient will complain headache. Vaginitis in adolescents, caused by candida which thrives in hyperglycemic tissue. So due to hyperglycemia, the adolescent patients can complain of vaginitis, the inflammation of the vaginal, the tissue. So is caused by the candida. Fruity odor or to breath, when you will smell the patient, the mouth smell, that will be fruity odor to breathe. Fruity odor to breathe. Dehydration, blurred vision, slow wound healing. That is the assessments. Change in level of consciousness. Level of consciousness will be change. Now we will talk about the long term effects. So that we talk assessment is the normal effects. Now we will talk about the long term effects. What the long term effects? Failure to grow at a normal rate. Failure to grow at a normal rate. Then delayed maturation. Then what will happen? Recurrent infections. Recurrent infections will be there with the patient of DM. What complications will happen? Complications of DM. The complications: hypoglycemia, hypo and hyperglycemia. This is the complications of the DM. DKA, diabetic ketoacidosis, coma, hypokalemia and hyperkalemia, mean less potassium, and the hyper more potassium. Microvascular changes, cardiovascular problems, retinal disease and renal diseases. Retinal microvascular disease and renal microvascular disease. Neuropathy. So this is all complications related to DM type 1. How we will manage this one? The management or treatment. How we will manage the DM type 1? So always diet modification. How we will do diet modification? Normal healthy nutrition is encouraged. Normal healthy nutrition. Normal healthy nutrition. So total number of calories is individualized based on the age and growth expectation. So the calories requirement we are giving to the patient according to his age and according to the growth expectations. And the diet as prescribed by the primary health care provider. Diet according to the doctor. Dietary intake would include 3 well-balanced meals. 3 well-balanced meal. What is well-balanced? 3 meals per day eaten at regular intervals, plus mid-afternoon snacks and bedtime snacks. Mid-afternoon and bedtime snacks. Then instruct children and parents to carry a source of glucose. Always tell to the parents or the children to take a source of glucose in case of hypoglycemia. So always keep glucose source, mean any candies or any biscuits. So take always, whenever they will go somewhere, always keep with them in case of hypoglycemia. Allow the child to participate in making food choices to provide a sense of control. So always give a food choices to the child, so then he can select whatever he wants to eat, but according to the diabetes protocols. Then the next is very important, exercise. Very important. So what exercise? Instruct the child in dietary adjustment when exercising. For example, extra foods need to be consumed for increased activity. For example, if he is participating in any activity like running or any other participation, so he need to be consumed for increased this extra food needs. Usually how much? 10 to 15 gram of carbohydrates, 10 to 15 gram of carbohydrates for every 30 to 45 minutes of activity. For example, if he is running 30 to 45 minutes, so he need to consume 10 to 15 gram of carbohydrates. So extra food needs to be consumed every 30 to 45 minutes of activity. Then instruct the child to monitor, even instruct the patient to monitor the blood glucose level before and after exercising. If he is participating in any activity, so he will check blood sugar before and after. Very important. The next is insulin. Very important. So insulin, for the laboratory evaluation, which test we are doing? HbA1c every 3 months. So HbA1c test is giving us the range of the blood sugar for the previous 3 months readings. So HbA1c every 3 months. Number 2, and the HbA1c normal value should be less than 6%. Less than 6. That is the normal value of the HbA1c. And number one more thing, keep in your mind, the illness, infection and stress. Any illness, infection and stress, but these three, illness, infection and stress, increase the need for insulin. Increase the need for insulin. So this illness, infection and stress will increase the need for insulin, and insulin would not be withheld during illness, infection or stress, because hyperglycemia and ketoacidosis can result. So never stop, never withhold insulin in illness and infection and the stress, because if we will stop the insulin, withhold the insulin, so what will happen? Hyperglycemia and ketoacidosis can be the result. When the child is not receiving anything by mouth for a special procedure, for example, the patient is going for any procedure, any operation, and we have to inform the primary health care provider. Either it's depend on the doctor, he will stop or he will continue the insulin, the morning dose, withhold the morning insulin, and when food, fluids and insulin are to be resumed. So it's depend on the primary health care provider. Instruct the patient and child and parents in the administration of insulin. So we will always instruct, very important, instruct the parents for the insulin administration. We will demonstrate, we will guide them how to administer the insulin. Instruct the patient or the child of the parents to recognize symptoms of hypoglycemia and hyperglycemia. So symptoms of hypo and hyper, we will inform, we will guide the patient and the parents of the child what the symptoms of hypo and hyperglycemia, so they will further do the management accordingly, according to the symptoms. Instruct the patient and the child of the parents always to have a spare bottle of insulin available. That is very important. Then advise the parents to obtain a medic alert bracelet indicating the type and daily insulin doses prescribed for the child. So they can make the book or the bracelet, and where mentioned will be the which type of diabetes patient have, and the how much insulin he is taking, and what's the time of insulin they are taking. Now the blood glucose monitoring. But blood glucose monitoring also important. So blood glucose monitoring, instruct the patient and the parents of a child about the proper procedure for obtaining the blood glucose level, how they will check the blood glucose level, the demonstrate the patient and the parents of the child so they can do at home properly. Number 2, hand washing. Instruct the patient and the parent of a child do hand washing before and after performing the procedure to prevent the infection. Stress the importance of following the manufacturer instructions. Manufacturer instructions. What manufacturer instructions for the blood glucose monitoring device? Glucometer. So we have to instruct the patient and the parents of a child also regarding this. And then instruct the patient and the child of the parents to check the expiration date on the test strips used for blood glucose monitoring. So expiration date of the strips they have to check. The last is urine testing. Urine testing, what we will check in the urine? We will check the ketones and glucose. Ketones and glucose for the urine test. Teach the patient and the child that the second voided urine specimen is most accurate. Which one? Second voided urine is more accurate. Don't give the first, that when we are going to toilet, the first urine have maybe the organisms or the germs, but the second voided urine is most accurate. And the presence of ketones may indicate impending ketoacidosis. If there is a ketones in the urine, may indicate impending ketoacidosis. The urine glucose testing is an unreliable method of monitoring the glucose level. However, the urine needs to be tested for ketones when the child is ill or when the blood glucose level is consistently greater than 200 mg per dl, greater than 11.4 millimole, or as specified by the primary health care provider. So urine testing is very important. Is not more reliable method, but we have to check for the ketones and the glucose. I hope you like the lecture. If you like, please share and subscribe my channel, and don't forget to push the icon bell button so you can receive my coming videos notification. Thank you very much. Take care of yourself and family. Allah Hafiz.